Well, I was to a point where I was so heavy that I could hardly breathe. And my physician said, well, Phil, you've got a lot of issues. You have COPD, you have congestive heart failure, you have arrhythmia, you have all these sorts of things. So I began to use that as my excuse. I think that there's no accountability to what I did. And being a bachelor, again, I opted for the easiest foods. I could not walk but 3 or 4 steps without losing my breath and having to stop. I don't want to live anymore. This is just not good.
Phil was referred to our pulmonary rehab program in September of 2009. He was diagnosed with chronic obstructive pulmonary disease. He was diabetic, overweight, led a fairly sedentary lifestyle, had high blood pressure, so he had a lot of things to work on.
His health was really overtaking how he felt. And emotionally, he just was struggling. And I could also tell he just wanted to give up. And finally, I suggested Meritor's health psychologist.
And then as your health deteriorates, your depression may actually get worse, and you end up in a cycle where any place you can start to make an improvement, whether it's health behaviors or whether it's mood, is probably going to affect the other.
I really find that most people know the basics of healthy eating. Most of us know an apple is better than a cookie. But changing those behaviors is really the difficult part. And I think that's where the health psychologists really come in that we work with.
We developed a treatment plan for him, and that involved helping him establish a regular exercise program, establish some realistic goals. Phil wanted to lose weight. His goal weight over a long period of time was to lose 100 pounds.
And I think that's the big difference for him. He wants to get better. He wants to feel better.
And what we're doing is we are always coordinating cares. We have a team-based goal for this patient, and the patient, of course, is the center of the team. And then we all work towards those goals, and we keep in touch.
And I had to report to Kim every Monday what my weight was. So I was accountable to Kim, which then made me want to continue. I didn't want to relapse.
He can walk down the hallway, obviously, without stopping, where before he had to stop a few times. And his energy level is up, and you can just completely tell he feels so much better.
I gained my ability to breathe. I went from 300 units of insulin to nothing, and not even pills. It has done wonders for me, and I always call Kim my savior, so to speak. They're so friendly, and they're so understanding, and so forgiving, if you will, that it makes it wonderful. You want to come here. I want to lose 25 more pounds, so I can say I've lost 100.
He really feels good about himself, and it's really made a big difference.